Hello, I'm Patrick Moore.
I'm Marlisa McLaughlin.
Welcome to Health Buzz.
Perspectives on natural health and healing.
We're excited and honored to bring this program to you today, and I'd like to introduce you to Bo. Bo is a beautiful golden retriever, and the topic of our show today is the healing power of service dogs. And Bo is on his way to becoming one of those service dogs, and service dogs are specially trained dogs. They learn how to perform a variety of different tasks and work details in support of the physically and mentally disabled. In essence, they become the medical partner and a medical assistant to enhance the quality of life, and actually, in many cases, they can be life-saving. So before we get into that, because we got some great experts here and professionals who are going to share the whole world of service dogs, I just want to make a few comments about the future of canines in the medical care system. Recent studies have shown that dogs have a sense of smell, up to 10,000 times that of a human. So in the publication of Lancet, the respected British journal, and I may have to move a little during this with Bo, that they're using them to detect cancer because of their sense of smell. And the recent study showed that some of these cancer cells secrete a protein which gives off an odor. Humans can't detect that odor, but dogs can. So it's remarkable. So in the future, Marlisa, we might see, instead of going for a CAT scan, we might go for a
dog scan.
Dog scan. It's pretty remarkable. And because of their sense of smell, you know, some of the service dogs are being used with diabetics because whatever it is, whether it's the sweat or the urine or the breath, they can detect that and can see what blood sugar is dysregulated, low blood sugar, high blood sugar, and alert the owner and really make a difference. And we're seeing that with seizures too. So anyway, before we kick it off, one of our regular guests here, couldn't make it today, and that's my daughter Carolina, our student nutritionist, and I know she loves dogs, right?
She sure does.
And I know she'd love to have a puppy just like Bo, right? I bet Carolina would love you. So anyway, a little shout out to Carolina, Fernanda, and if you study hard, Carolina, keep those great grades up, you may have a furry surprise in the future come visit you, okay? So Marlisa?
We are delighted to welcome a wonderful guest. We actually have two wonderful guests that are not furry today. And we're going to just bring this right in. We have Carolyn Sires. She is a registered physical therapist. She is a business owner, successful business owner for 30 years. She has an associate's degree in psychology. This is so tricky too, and a master's degree in both physiology and business. She is also a certified raptor rescuer for the state of Connecticut and an active member of a variety of animal support organizations. Carolyn worked as a volunteer for 20 years for equine therapy at Yale University until they closed their stables, and her volunteer work with horses and children with various disabilities led her to her present volunteer position working for ECAD, a nonprofit organization, and that stands for Educated Canines Assisting with Disabilities. Carolyn shares the philosophy with us here at Health Buzz that animals are alternative forms of healing and can drastically reduce the need for medications in the traditional medical formats. Welcome, Carolyn.
Thank you both for inviting me here.
And a friend along with you. Would you do us the honors of?
Blue. We have Blue, who is doing his job as a service dog right now. Blue is 10 years old, and he's been a service dog his whole life. And you see Blue doing a job out of sight, out of mind. Wherever we go, he will go underneath the table, underneath the chair. Even as a large animal, he tries to shrink, and that is his job, not to be intrusive, but to be there. If I need him, he will come right to attention.
Thank you. Welcome, Blue. Can you see
Hello, Blue.
So, what is a service dog? First of all, a lot of us might not know the difference between a service dog, a therapy dog, or even a pet. You know,
So important that you asked that question, especially nowadays. A lot of people are taking their pets and vesting them as service dogs. So there's 4 categories of dogs. Let me start with comfort care. Comfort care is a dog that can be a pet that you need to lower your blood pressure, to reduce anxiety, to make you comfortable in your activities of daily living. That's one dog, that's a comfort care. Then you can have a therapy dog, which again is a pet that you decide is so well trained that you could take them to hospitals and organizations and share your love of your pet with other patients and other people. That's a therapy dog. A service dog is in a category all by itself. A service dog is born as a service dog. It is bred for a temperament such as Bo and Blue, and you will see Dozer later.
And we have an image up for our viewers with you and our next guest coming up soon, and a third party working for ECAD. So there you are on the screen with your 3 dogs.
That is correct.
So those are all service dogs.
All service dogs, soldier-oriented for the soldiers who have had some physical or emotional disability. Those 3 ECAD dogs have been trained to work with the different abilities of those soldiers. And when I say that, what's important to know with service dogs is although they're assigned to somebody with a disability, they work on that person's ability. Yeah. For example, if I can't talk, they'll learn nonverbal cues. If I can't bend, they'll learn the ability of the cues that I can do.
So they're customized then, in a way, customized to the disability specific.
Extremely customized.
Yes.
They're streamlined and customized. My service dog will be different than Bo, will be different than Dozer. They have all different abilities. If I were nonverbal, they would work to sign cues. If I had a limb loss, they would be my leg. If I had a traumatic brain injury, they would be the brains, the external part. They're external medical devices.
Amazing.
Yep.
It's really amazing. So how did you become a service dog liaison?
For 20 years, I did equine therapy at Yale, and I saw the magnificent response with the children up on the horses. And these children who had no verbal cues, they had no interaction with society. As soon as you put them on a horse, they would come to life. It was like a Disney film. So I wanted to always stay with animals. Yale closed the stables, and I thought I have to continue giving to the community. What can I do? And I researched and decided that ECAD, Educated Canines Assisting Disabilities, would be the perfect fit to replace the equine therapy.
And so if you were in public, how would someone that doesn't know that be able to identify, well, like 2 questions you had mentioned that a service dog should have, the handler might be asked?
Which is something that should get out more to the public, because the public feels very awkward as to what do I ask this person? It's obviously a physical device that lets you know that that person is disabled. So what you can do when you approach the person is say, is that dog used for a disability? And what does that dog perform? But what's important is what you cannot say. You cannot ask, what is your disability? You cannot ask me to show you a trick or show you what the dog performs. It is not a show. It is not something that you should expose people to. The Americans with Disability Act take the privacy very seriously, and more people need to know those are 2 questions you should ask, and those are 2 questions that a handler should make sure their dog obeys those questions.
Oh, thank you for that.
Yes, so a service dog can go, with the American Disabilities Act, it's allowed to go into airplanes and any public place,
Yes,
condos, housing.
Anywhere. You cannot be denied any entrance to anywhere. If a human can go, a service dog can go. The only place they cannot go is into the operating room in a sterile environment. But they can go pre-op, they can go post-op, they just can't go into that operating room.
And will they always be marked? Will they always have their jacket on it?
A handler, which is the human part of this canine team, should know that you really should identify your service dog. They don't need to.
No requirement.
There's
right.
no requirement, but it is proper. It is what you would want to do to avoid conflict. Well, you don't want to get into a situation where people are asking you awkward questions and you're awkward. Then you have a gathering of people around. Show your respect for the public and have your vest on.
And
So Carolyn, could you share your experience with some of the health applications that, medical conditions that you've experienced?
In my career as physical therapy, the stellar treatment that service dogs have, it far surpasses the human interaction. Diabetes, post-traumatic stress disorder, multiple sclerosis, autism, Parkinson. There's so many abilities, disabilities, and diagnoses that these dogs work with.
And here's an image of a young woman who is with her dog after surgery. That's a friend of yours? Somebody you work with?
Wonderful, wonderful young lady who's had multiple surgeries, and this is one that we used as part of a study when she was pre-op with Blue. That's the service dog Blue, who's used as a facility dog. The anesthesia time was cut almost in half because she was allowed to lay down with Blue and comfort her during the surgery. So we got many recommendations from the surgery team and from the parents of the dog requesting from now on that Blue goes in the operating pre-op
Wow.
with her.
That's
Okay.
amazing.
Yeah.
And
Nice.
also, they can pull wheelchairs. We have an image of a woman in her wheelchair with her service dog. Or is that Blue?
No, that is a service dog, which is what I say, different abilities. If somebody has a wheelchair, these dogs must be trained to go pull the wheelchair, open the doors, press the handicap button, and that is a specific training that they will have for the ability of the patient. Yes.
Which is a great thing to talk about now is training, because I'm sure this is extensive. Could you just give us a little quick rundown of the types of training processes?
A big question that all of us get asked when we go out is the training. A service dog training is 1,500 to 1,900 hours
Wow.
of the training. The training starts then when the service dog partners with their patient or with their handler. That is the beginning of the training. They start a lifelong commitment of training, and ECAD is Assistance Dog International Certified, which is an accredited program that accredits ECAD to train these particular dogs for people with disabilities.
Now, ECAD stands for Educated Canines Assisting Disabilities, is that it?
That's correct.
Okay.
Yep, that's what ECAD is. Educated Canine Assisting Disabilities. They've been in business 20 years. Why I selected ECAD to take over for my equine is that I researched Tennessee, Kentucky, Florida, and I went right back to Connecticut. ECAD is an organization dedicated to the community, to Connecticut. They use at-risk youth to help train these guys. Their dogs go to Niantic Women's Prison as part of their training, and then they get partnered with, they have a Project Heal, which is for the military, which is a passion that I have, that they're partnered with the military and other abilities. ECAD is, when donations come to ECAD, they go right to that patient. That's what I love about ECAD, is that they truly put their donations to work with the patients.
So even the organization is a holistic organization. On many levels, there are layers and layers, and they all support the core purpose.
Absolutely. ECAD has many layers. They've been in so many areas that ECAD has that I'd like to spend time, but if you go on their website, you'll see it's a stellar, solid organization. As a medical professional, I would only be with somebody who has the scientific backing and the love of non-medical intervention and using these dogs to help people progress and live a quality life.
Wonderful.
Thank you,
So in essence, I mean, the training is thorough, extensive, it's serious. I mean, this is serious business.
Very serious.
Yes.
ECAD,
Yeah.
you can go back to ECAD as long as you want for the training, but once a year you have to get tested. These dogs will not pass, and they'll have to go back to boot camp if they fail. And if the dog fails, I put the responsibility on the handler, because the handler's responsibility is to keep that dog as a service dog, to keep the love for that dog dog wants to continue its path in life, which is to make your quality of life better.
Okay, great. I'd like to introduce our next guest, too. I would like to get up and shake your hand, but I don't think Bo wants. Come on in, Lieutenant Colonel. This is Lieutenant Colonel Tony Charles. He is Operation Iraqi Freedom veteran, injured in combat situations, and he's an Army chaplain, fully disabled. Welcome.
Welcome
Thank
and
you.
thank you
Nice to see
so
you.
much for your
Nice to meet
service.
you. Nice
Yes.
to be with you.
So your service dog, this is
This is Dozer.
Dozer. Dozer, come on,
Dozer.
Dozer. Nice to meet you, Dozer.
Yeah, come right up in here.
Tony, could you give our audience an idea of what your medical condition was, diagnoses and everything like that when you came back, and what you went through?
Some of these things didn't show up for a couple of years. So, which often happens with PTSD and
Yeah.
mild traumatic brain injury.
Post-traumatic stress disorder,
Right.
yes.
PTSD, post-traumatic stress disorder. And I was in a rollover of a 5-ton truck and was thrown out of the vehicle and landed on my back. So
Oh, boy.
that affected me. I had a concussion, but things didn't show up right away. But
Yeah.
eventually, it became clear that I wasn't the same person.
Yeah. You had a brain injury.
I did, and it affected my vision, blurred vision, double vision at times, having times when I passed out from leaning over, a number of things, and then having nightmares, a lot of things that led to eventually a breakdown, and I had to go inpatient for 2 months for PTSD.
Yeah.
I had to give
Is
up.
this through the VA, the Veterans Administration?
Yes, through the VA, I went to a program, a stress disorder treatment program out in Topeka, Kansas, and then after I came back and was working with therapists, I learned of a program that trained dogs to work with veterans with the kinds of problems that I had. I got put on a waiting list that the VA had, and then after a few months I got told that the program for veterans with PTSD and mild traumatic brain injury had been scrapped, that
They're just using it for missing limbs?
they would
and-
only use it for veterans that were amputees or that had severe traumatic brain injury.
Yeah.
And so, I was out of luck.
So you were on, were they giving you typically lots of medications?
Oh, I was on, for pain, I was on hydrocodone, which is an opioid. I was on OxyContin for a while.
Did you get addicted to that? Or?
I have to say that what happens is you build up a tolerance, and it takes more and more of the drug to give the same kind of relief. I wasn't addicted. I wasn't drug seeking,
Yeah.
like a drug
Sure.
addict would be. But I definitely was drug dependent.
And what was your life like when you were able to work?
I was totally disabled. I couldn't hold down a job. I tried to go to school to get a master's in social work. I flunked out of school, and I felt suicidal. And that's when I got into treatment, full-time, a 2-month program. When I came back, wondered what I'm going to do with my life, I began looking at some ways that maybe I could get involved with volunteering, but even that was too stressful.
Yeah.
And eventually, I heard about this program for pairing veterans with service dogs, and someone recommended a book to me called Until Tuesday, and that book changed my life.
Yeah.
And we have, actually, there's a cover of Until Tuesday. It was on the New York Times bestseller list.
Yes.
And
So
that-
many people are.
That, Carolyn, that is
Blue's
Blue's
brother.
brother.
Blue's
Yes.
brother,
Blues
that's
Brothers.
right.
Right.
Blue, there's your brother up on the screen.
Wake up.
And you're holding Blue's nephew.
So that book changed your life.
It did, because I realized, oh my God, this program is in the state of Connecticut that trained Tuesday. And so I filled out an application, and I began the admissions process. I had to have doctor's referrals. I had to be interviewed personally twice. I had to have referrals from neighbors. And
So after
forth.
that, you were accepted?
I got accepted into the program, but found out it cost a lot of money.
So this is where, for a lot of those people out there, fundraising is really important, all that
Yes.
kind of support.
Exactly.
I just want to make a note on that, because you said you were feeling suicidal and going through all of that. It's amazing that 22 veterans commit suicide across America every single day. I mean,
right.
it's stunning, and a lot of them do have, as you said before, these type of injuries, brain injuries. They don't show up for years.
No.
And there's also that military mentality that a sign of weakness if you ask for help, right?
Exactly.
Nobody wants it. It can affect your career, and it can affect your relationships, that I don't need help. So that's a psychological component. So you got into the program, and you had to go through training yourself, right, to prepare for a service dog.
Yes, well, I began doing sweat equity work, which is attending fundraisers, talking to organizations like the VFW, the vet centers.
What does it cost? How much for a service dog?
In our area, in the Northeast, it's anywhere from $25,000 to $30,000
Right.
for the service dog. And on the West Coast, it's $50,000. So it depends on where you are.
Yeah, it's a tough situation.
But
there,
it costs a lot of money.
so tell us about that time when you first met Dozer.
Right.
Your musical chair thing you told me about. Okay.
What you're referring to is when it came time for the disabled clients to be paired with their service dog, we all came together and we had to spend 14 days in the facility, and we nicknamed it boot camp. It was a training program, but very much like boot camp. You're living 24/7 with these other guys and gals and their dogs, and so in the very beginning, they would have us interact with the dogs, and the dogs were running around in a big room like this, and then we were told to take a seat. And all of a sudden, the dogs begin looking around, and the dog actually comes to the person they're most drawn to.
That's
And
yeah.
Dozer came to me, and I said in my thinking, wow, this would be too good to be true if I got paired with this dog, because to me, he was the best looking, best acting dog that I'd ever seen.
So the dog Dozer chose you.
He did.
Good. Now, tell us about at home. What are some of the things that Dozer does to help you out, and that's how it's changed your life? And it changes the family too. I mean, family relationships, marriages, and everything like that. It affects everyone.
Yes, well, Dozer and I started bonding right away in the training, and I actually had a nightmare while I was there during the 2-week time, and Dozer showed what I could expect from him. I mean, he woke me up from the nightmare by licking my arm and thumping me with his head on my chest. He pulled the cover off. I got up. I was disoriented where I was. He went over, flipped on the light switch. I went to the door, and I was terrified that there might be someone. I felt danger.
Like an intruder or something.
Right,
Yeah.
and he went into every room in our compound, to the left, to the right, in front of me, and came back and then sat right in front of me to report. It's safe.
That it's safe, coast is clear.
Right.
And that calms you down because you were maybe prone to panic attack, anxiety attack.
Exactly, and night terrors are nightmares. And he did that before I even realized that he was capable of doing it. And so when I had nightmares at home, he continued to do those same kinds of things. He assists me with dizziness because of some of the medication I take, as well as because of the head injury. There's times when I will become dizzy or get blurred vision, and
The walking too, right?
Yep, and he will assist me in ascending and descending stairs as balance stability.
And you told me Dozer may have saved your life with that intelligent disobedience. You were going to cross the street, a car was coming, and
one of the things that service dogs can do is practice intelligent disobedience, which actually is, they know that you're saying, "Come, let's go," or heel. And as I was in the process of walking across the street between a line of cars, and I stepped out, and all of a sudden Dozer jerked me back, and I tugged, and he wouldn't go. And then the next thing I knew, a car was passing by and blowing their horn at me. So he literally disobeyed my command to go forward, pulled me back, and saved my life. And this has happened a couple of times. Wow. And I'm thankful for that. I'm much more mindful to pay attention to him when he may not want to go. Maybe there's something I need to pay attention to that I don't know about. Because he hears the cars coming, he can see what I can't see, especially when I have blurred vision.
like, since you've had Dozer for 2 years now,
Right.
you told me Christmas Eve,
Right. He
His
was born-
birthday,
he was born on Christmas Eve.
before.
Yeah.
How has that changed your life? I mean, from a medication standpoint
Mm.
and psychologically?
Well, when I got Dozer, I weighed over 250 pounds because I've had to walk him, and sometimes
I'll
walking
get
up
you
to
out.
4 miles a day. I've lost over 50 pounds now. I've come off of heart medication and pain medication. The only thing I take is Tylenol for pain, and I don't need those drugs anymore because I feel so much better. And he's improved the quality of my life. I'm not depressed anymore. That's in remission. And I still have times when I have flashbacks, or I have times when I will get overwhelmed with anxiety. But Dozer will come, he'll push into my knee, he'll put his head on my knee. He will make his presence known, so I have to pay attention to him, which then frees me up to realize, okay, I'm not in Iraq, I'm not over in the desert, I'm here, and I'm safe.
Yeah. Interesting. How has this affected your relationship with your wife?
My wife, she doesn't have to get up with me in the middle of the night because I had a nightmare. Now, Dozer will come to my side of the bed, wake me up, and I'll go out with him, and she can sleep and not have to be sleep deprived all the time. A lot of things that she had to worry about, she doesn't have to worry about anymore because Dozer helps me with those things. And she sees him as a very, very welcome addition to our family.
Wow. Do you have any questions?
I'm just so amazed and I'm so grateful that you've been able to come here and share this with us, this really personal experience. And it's amazing to be sitting here with everybody because the general tone for me, I'm very emotional in a really good way. I feel so grateful that we have learned so much and we've paid attention enough to know that there are different ways to approach. And so instead of deafening and dumbing and driving yourself down because you were ill, you've come to life and you're sharing so much and helping so many people. So I just wanted to
Colonel
thank
Charles,
you, Carolyn.
we all thank you for your service to the country, and I think any vet who's been injured, there should be no price tag to get them anything they can to improve their quality of life with the service you've given to our country. Carolyn, could you speak a little bit about volunteer activities? How do people get involved now? What's the direction? With 1 minute.
The direction is to look on ECAD's website, and they have a lot of programs.
That's ECAD.
It's up there on the screen.
ECAD1.org. It's to look on their website, contact them, know that my thing is your donations have helped. The donations help soldiers, the donations help disabilities people. You need to get involved to be a service dog person that knows what we're doing. And you need to talk to people and get involved. And I will tell you why I picked ECAD is their donations go right to the patient. And I think it's really important.
Okay. Well, we'd like to thank you very much. We're honored to have both of you here. We have to do a few shows on this.
Thank you so much.
Thank you, Bo. Thank you, Dozer. Thank you, Blue. And thank you, audience.
And
Thank you.
also thanks to SEC TV, who've done a remarkable job organizing this show tonight and all the other shows they've done. So give them a call and let them know that you care about the service that they're providing for you. Make a donation. And thank you very much for joining us.
Thank you, everybody.
And like us
Thank
on
you,
Facebook.
Nice show.
Wow.